Good afternoon. My name is Jacob Livingston, and today I'm going to be talking about payment options for the United States healthcare system. I want to start by saying thank you to Elizabeth Kerns for her previous video on bundled payments. I really do think it's a good solution to lower costs and increase the quality of care in the United States. Although there are challenges, such as collaborating with different venues of care and determining how much each piece of the treatment gets paid, implementing these programs, educating people, I still think that there are positive aspects of this solution that can be explored and used to benefit the healthcare system in the United States. Because we are spending an outrageous amount and not getting the quality of medical care that we're paying for as a nation. So today I want to talk about a story of an experience I had in another nation with paying for medical bills, and as well as talk about a couple different payment options that we might be able to implement in the United States. So the United States, again, is overpaying on healthcare. I want to start with a example of how much people are getting paid or charged for their medical care, which is outrageous. CNN did an interview on a family that was blindsided by medical bills that got up to $474,000 for a 60-year-old patient that just spent a few days in the ICU suffering from difficulty breathing. That is an insane amount of money, and that's an outrageous example, but it's just an example of how bad it can get in the United States. Another example is in 2011, a report came out by the global consulting firm Milliman, and it said that the annual healthcare bills for a family of four in the United States was a staggering $20,000 a year. $20,000 a year for a family just to get medical care. Now, if that's the case and they're getting the best medical care in the world, that's understandable. But again, our outcomes are not better than other nations that are spending far less on their medical bills. So, in my mind, I didn't realize how bad things were until I started taking this class, and it was an outrageous amount of money that we are paying as a nation for medical expenses. When I took a trip to South Korea, it would cost me $4,000 to stay for a month. That includes my plane ticket, my stays in hotels, traveling around the nation, eating, everything for $4,000. And while I was there, my little brother badly sprained his wrist. So he had to go to the hospital while we were there. And it's very eye-opening to experience the medical care in another country. And the most impressive part to me was the cost. So he was able to receive medical treatment for a medical team including physicians, pharmacists, and nurses, where they diagnosed his condition. He had x-rays done of his wrist. They prescribed medication. They gave him a cast. He was able to pick up his medication all for under $300, and also within one afternoon, but that's a different topic. So under $300 to get all of those services is very reasonable in my mind. Now, when I did some research on what that would have cost in the United States, healthcare.gov has estimated similar procedures in the United States ranging from $3,000 to $4,000 to have everything done that he had to get done. $3,000 to $4,000. So we could have gone to South Korea for a month, gotten his procedure done for the same price that we could have gotten the procedure done here in the United States. That's outrageous. So I want to discuss a few different payment models. South Korea uses a social health care insurance model that covers the entire population, which I understand we won't be able to implement in the United States because socialized medicine doesn't seem like an option. However, there's pay for coordination, and the pay for coordination goes beyond fee for service by coordinating care between the primary care providers and the specialists. Coordinating care between multiple providers can help patients and their families manage to a unified care plan, and can help reduce the redundancy in expense tests and procedures. That's a great option. But another option that I've explored is a global budget option. And I think this would be a good option for us to explore in the United States because it puts a cap on how much we can spend. With our spending getting out of control, honestly, it's already out of control in the United States. This would put a cap on how much we can spend per year. So the global budget payment option is a fixed dollar amount paid annually for all care delivered. However, participating providers can determine how dollars are spent. Global budgets limit the level and the rate of increase of healthcare costs, and global budgets typically include the quality component as well. This would stop the rising healthcare costs and put a limit on the amount that people were allowed to spend on healthcare. We would also be able to increase the quality of care by making sure that they got the care that they needed and eliminated any extraneous care that they really didn't need. So that would reduce the costs, increase the care, and I feel like it would make people pay more attention to the care that they do receive because the dollars that they have are limited. There's not an unlimited amount of money that they can spend, and every person has a cap. So I think this might be a good option just to limit the amount of money that we're spending in the United States to stop this outrageous spending and keep us out of debt. Thank you for listening. Have a great day.